Uncle Joe, how are you?
Oh, doing good. I've got a question for the doctor. If she would be kind enough to explain the cirrhosis of the liver, you can get it two ways. One, everybody knows, is alcohol, but the other one has to do with the diet and the excess fat around the liver. Can you expound on that?
Yes, absolutely.
All right, thanks a lot.
That's a great question. The commonest cause of liver disease in America is not alcohol and it's not hepatitis C. It is actually fatty liver that is created by this epidemic that we are facing in America today called obesity. So when people start gaining body fat, especially around the center of the body, we tend to think that, oh, it's just the looks. I just have a little pot belly. It's not true. The fat is accumulating inside all of your internal organs in the center of your body. So your liver is becoming fatty, your pancreas is getting fatty, you're becoming more insulin resistant and prone to diabetes. So this syndrome of fatty infiltration of the liver induces an inflammation of the liver that then progresses to fibrosis and then cirrhosis and stage liver disease.
So that innocuous little tiny bicycle spare tire around your stomach is actually fat that's infiltrating your organs?
Yeah, so this is just an tip of the iceberg that you see. That little belly that you see on the outside. There's a lot of things happening in the internal organs in the center of your body.
Do you know why it is both refreshing and a little bit cumbersome? Listening to you every, I don't know, what do you do this every month? Because I know that there's people, I'm sure Peter and Uncle Joe and anybody who didn't call in realizes that the things that you're talking about mean that each one of us has to make some sort of, I don't want to say change because that's a little bit too abrupt, just slight ameliorations to how they go about what they're doing. You know what I mean? In other words, you got to eat a little bit better. Peter's got to stay up when he doesn't want to. You know, Uncle Joe's probably going, oh, man, I must have some fatty infiltration into my organs, so I need to get out and start walking. Everybody's got to do something a little bit different than what they're doing, and that's tough.
Yeah, so why would you, I think change is not a bad thing. When you find that you are static in where you are and you feel like there could be something better you could feel and perceive in life, I think we need to first have acceptance, and then change becomes easier. When we do not accept that there is a need for change, then we're not going to get to the next level.
Dr. Mary Tilak is in here, and of course she will still take your calls at 219-845-1100.
Good morning, Doctor. I just have a quick question for you, and then I'll hang up and listen for your response, please.
Yes.
And you may have answered part of it for me, but without the use of pills and medications, what can a person do to prevent, control, or stop the fatty liver disease? And I'll hang up and listen
All right. Thanks a lot.
All right.
Currently, there is no medication that is effective to treat fatty liver disease. So it is all lifestyle modification. Weight reduction, exercise, has a significant effect in reducing the fatty infiltration and the inflammatory process that occurs in the liver and other internal organs, including your blood vessels. So cutting out processed food, reducing the amount of carbohydrate starches, which is your bread, rice, pasta, potatoes kind of food, smaller portions. We have become such a portion distorted society, and that's where I'm not asking about completely eliminating these. We need to realize that we are so portion distorted and understand the portions of carbohydrates. People think fat means reduce your fat. That is very wrong. It is the sugars and starches that get converted to fat in your body, and in our society, relatively we overdo carbohydrates, so we need to cut down on that. And obviously saturated fats that come from red meats and fried foods and all your pastries and bakery items that have all the butter and lard that goes into it. So this is like a blanket statement to say what are the lifestyle changes we could do.
You just basically cut out just about all foods that are any fun whatsoever. What about beer?
Okay, I'll tell you what is fun, though. Fun is a perception that you attach. These are all behavioral changes that you've done over a period of years that has become a habit. So you just think that. It's like if you see fire, you move away. And you think that if I see a donut, oh, I'm happy. These are behavioral imprints that you've made in your mind, and it needs to be changed to a different thing. So that when you look at something else, you look a bottle of water and exercise, you feel the same enthusiasm that you feel when you look at a donut.
And a nice cold glass of milk,
Sure.
whole milk.
These are learned behaviors.
219-845-1100. I will say this, that since Sweet House Bakery closed and they had all the donuts around here all the time, I do have a little bit longer day. I mean, I would eat 1 or 2 donuts right after the show every day when the donuts were always here. And it felt so much. I miss it right now. It's 9.
But you felt tired.
I felt tired a little bit late, like an
Yes.
hour later. I'd always feel kind of tired.
And I explained that to you. Why? Because your sugars went up in the first few minutes an hour, and the second or third hour it drops. And you feel that as tired. Even when we looked at you, you felt tired. I had so many of my patients and my office manager comment and said, he's looking much more brighter and looking much younger on these pictures. They're looking at the streamed videos, and they are seeing the change. They're seeing the difference in you.
Yeah, but it doesn't change the fact that I can't in my brain at 52 now say that, all right, I've got to change so that having a bottle of water and exercising is the same kind of hedonistic pleasure as 2 Sweet House Bakery donuts and a big glass of whole milk. I'm sorry. I mean, they're not. I'm not going to make that complete change. I'm eating a banana now. I'm starving right now.
You should be, because you need more than a banana for breakfast. But the thing is, unless your mind accepts, you're just fighting it. That's all it is. It's not true pleasure. I can give you donuts for the next 30 days, and I'll talk to you on the 31st day, and I will ask you if you are a happier man, I will let you stay with it. And I can bet on it.
Donut baby.